webinar, Engaging Public Health Officials Online, Strategies for Effective Communication. Thank you for taking the time to join us. My name is Sarah Dash, and I am honored to be your moderator for today's discussion. A little bit about me. I've spent my career working at the intersection of public health, health policy, and communication, and most recently as past CEO of the Alliance for Health Policy. So it's great to be back moderating a webinar. And we really tried to help bridge the gap between research, policy, and the public. Now, through my work with Dash Collaborations, I am a consultant, coach, and facilitator, and passionate about helping leaders find the right narrative and communication tools to tell their story and reach the right audience. So I'm particularly excited about how today's conversation is going to help us think through how public health professionals can harness digital media as well as traditional media tools to amplify their voices and make a meaningful impact. So before we begin, I do have a few housekeeping notes. First, please keep your microphones muted during the presentations to avoid any background noise. If you have any questions for our panelists, go ahead and submit them via the Q&A feature in the Zoom webinar. We'll get to as many as possible during the discussion portion of today's session. Finally, this webinar is being recorded, and a link will be shared afterwards, as well as some useful resources for you. So now let's meet our incredible panelists, each of whom is really bringing us some unique expertise in digital engagement, public health communication, and media strategy. First, we have Nick Dean. Nick is the Senior Vice President of Digital and Creative at Burness, where he leads teams that use strategic storytelling to elevate critical public health issues. He'll be talking about the power of non-traditional media platforms like LinkedIn, podcasts, and alternative digital outlets to shape public opinion and policy discussions. Next, we're joined by Dr. Sandra Albrecht. Sandra is Assistant Professor in the Department of Epidemiology at Columbia University's Mailman School of Public Health. But beyond her academic work, she's also a leading voice in digital health communication, particularly as a co-founder of Dear Pandemic, a social media platform that helps translate complex health information into accessible content during the COVID-19 pandemic. She will share insights on what she's learned about science communication in the digital age. Finally, we have Che Parker. Che is a Senior Vice President at Burness, specializing in communication strategies that build trust and encourage collaboration. He will discuss how public health professionals can develop effective messaging while also navigating the evolving role of traditional media in this space. And each of our panelists brings a really unique perspective to today's discussion, so I know we're in for an enlightening conversation. And with that, let's get started. Hi, everyone. Thanks for joining today. We're going to go ahead and hopefully you can see everybody now. Fantastic. Hi, guys. So I'm going to start off by just asking each of you to answer kind of an opening question, which is, what have we learned about public health communication in the last 5 years? And where do you see it going from here? So, Nick, let's go ahead and start with you.
That sounds good. Thanks, Sarah. Obviously, it's a really big question. We've learned and are learning a lot on the fly. So one thing I thought would be interesting to focus on with the question is this idea of that we really learned we are, in the past 5 years, that we're not going to be able to rely only on traditional media, though it has a really big importance. And even some of the more recently established newer forms of communication aren't going to be around forever. So really, we've got to be ready to evolve how we communicate, how we are trying to reach target audiences around public health messaging, the importance of public health. We are in a divided world of comms like never before, each pocket of people kind of siloing themselves. And that really leaves us communicators with the burden of going to each of them in different ways that make sense for what we're trying to communicate and the kind of communications objectives we're trying to achieve. So from a digital and creative perspective, the content looks different, the platform looks different, the brand and voice looks different. And that can be really challenging to know and stay ahead of the curve. So we're going to have to do that. We're going to have to stay current on the cutting edge of how people are getting their information and understanding where they're getting their news, what messengers they trust, and where those people are as well. If we really want to make sure that public health and public health information and right now the value of public health in general is seen and understood by the masses. We have to go there, and the masses are almost everywhere. So it's really getting to understand that and figuring out what makes sense for you. So strategic communications, which can sound like a buzzword, isn't really optional. You do have to be strategic. Digital communications is no longer really optional. It's required if you're wanting to promote and protect public health. I think that's a big lesson we've learned in the past 5 years, and people are getting on board with and doing really interesting creative work that I know we'll hear about today. Now's the time really to consider how in your work you can work on a digital comms plan and strategy. Does it look like an email program? Oftentimes when we hear the word digital, people think only social media, but there are a lot of different digital ways to reach people and talk to audiences. Does it look like an email program with updates on your work, short videos on social about the work you're doing and the topics that are connected to that? Maybe you go more in depth with analyses and perspectives on LinkedIn and that audience. Does your organization or your program do more to reach people directly? Are you the face of that? Can your partners and funders and other organizations help you tell that? Those are some of the questions we're needing to deal with each time we're trying to be really thoughtful and effective in our work. So, what's really the most effective way to do that? Is the question that we're contending with. And I think over the past 5 years and going to the next 5 years, that's the constant. The constant is constant evolution and being really thoughtful and tailored in your communications because we can't just blast to everyone and assume it's going to work. We have to be really thoughtful there. And I think that's been a big lesson in the past 5 years. So thanks for asking that, Sarah.
That's great. Thank you so much, Nick. And I look forward to getting into it with the rest of our panelists. So um, next, we're going to hear from Dr. Sandra Albrecht. And thank you so much for joining us today. I know you have firsthand experience in leveraging social media to engage the public with trusted health information. So would love to hear your thoughts on what you've learned and what you think we've learned, the collective we, about public health comms in the last 5 years, and where do you see it going?
Yeah, so I think actually this is a nice segue from what Nick was just talking about. So based on my experience doing science communication with a group of other colleagues, I will have to say too that we learned a lot of things. And coming up, we added a resource because we recently published a paper on a lot of the different things that we learned. But one of the major things that we did learn is that really anyone who is trained in public health should be part of communication efforts. And when I mean anyone, I mean anyone. So it doesn't have to be a professor or someone with an active research program only. So I think students, public health professionals, practitioners, folks with an MPH, really on any sort of degree, as well as scientists, will also need to be able to understand and synthesize research and then be able to translate it to different members of the public or their own communities. I don't think we can rely on, because the sort of the traditional model before was always this top-down approach, and we had the main people doing public health communications, whether it was at the CDC or local departments of health. And I think we've now gone beyond that. And so now I think everyone, we need the entire workforce really to be involved around in communications. I also think that training programs really should be making every effort to incorporate science communication into their programs. I know many have already begun to do this, which is really great, but I also think that moving forward, this is especially going to be really, really important. And, and again, to be part of MPH training programs, any other sort of scientific training program, it's going to be really important. And to sort of find different ways of communicating to the public. I think this is going to be really critical as we move forward. And just for those who may not be familiar with Dear Pandemic, or actually as we're actually now known as those nerdy girls. We were originally just a group of friends and colleagues with training in different aspects of public health. So when the pandemic broke out, family and friends had lots of questions. So what we did was, we took to social media. We were on a variety of platforms, including Facebook and formerly Twitter and Instagram and LinkedIn, and even now TikTok. So what we did, we took to social media to answer questions to translate the quickly evolving research for our loved ones. This really never started as a project that was meant to target a large group of people or the large, sort of segment of the public. And it really just started, as a sort of a labor of love just for our own family members, really. Um, and I should also note that I'm actually not trained in infectious diseases. I actually study chronic diseases, nor was I trained in science communication. But I do come from a background where I was the first to go to college in my immediate family. So I had to put myself in their shoes when it came to explaining different concepts. And that's how I kind of learned how to speak to different groups of people, especially those that don't have the level of training that I do. So I really kind of learned how to communicate just by actually doing it, and by talking to people that knew nothing about public health, but that would also be, forthright with me in terms of, being able to speak to me about whether or not they understood what I was trying to tell them. And it kind of helped me workshop the messaging that I was putting out there by just sort of communicating first just with loved ones. So, I think one of the keys to our success at Dear Pandemic and now those nerdy girls was that we actually started with a small audience of just family and friends. We didn't start as something large. We started small, and then as we put out more content that people thought was actually useful, it started getting shared. And then, long story short, we grew to millions of views across all our social media platforms and all around the world. Um, so I'd say that, a big key thing is that, it's something that we learned is, the importance of starting small, especially because that helps leverage the trust that you have, especially with loved ones. And, for some people, maybe you don't actually grow from there. You don't need to grow into the effort of Dear Pandemic that, which is what happened with us. But I think, so many of us who are trained in public health do have the ability to engage in good science communication like this, at least with our own people and with our own communities. And I think if we're able to do this, even if it's at small scale, I think it'll make a huge difference. So I think a big sort of key point is that everyone needs to be involved, and it's an all hands on deck effort from here on out.
Mm. Thank you so much for those insights. And I recently heard the phrase somebody was sharing in a public health related meeting, actually, like sort of this idea of like from the dinner table to the decision makers, or vice versa. And it does seem to me that, especially during the pandemic, right, when like literally nobody was exempt from having to think about these issues, having to figure out like how to incorporate these issues into their daily lives, or sometimes having it thrust upon them, or feeling encumbered in that way. That in increasingly, science communication, it's not just that scientist to scientist or public health professional to public health professional. It's really a broad expansion of the audience that we are working with here, as well as the source. And I think so. Thank you so much for sharing that, and I look forward to getting into that and to following those nerdy girls from here on out. And with that, I'd love to turn to Che. Che, help talk to us about the T word, trust. I think that I'm sure if
Mhm.
we did like an AI inquiry, that word, we've heard trust deficit, trust
Yeah,
recession. Like, how are you thinking about that now? How are you thinking about integrating
yeah.
trust? How are you thinking about it in the context of the changing media landscape? And where do you see us going from here? And I'm sorry because I just threw you like a kind of different question than I asked
Slightly,
everyone else, but
slightly.
feel free to
That's all right.
improvise on that.
No, this is
Thank
good,
you.
and I'm glad we're having this sort of casual conversation because honestly, that's what people want. They want casual conversations. When I talk to folks out in the field, they don't want people that sound like they're reading from their talking points, right? I've written a lot of talking points over the years, right? Like a lot. And I'm jumping ahead, but like podcasts, that's the beauty of that format, is because if you're talking to someone for an hour, 2 hours, 3 hours, it'll be pretty difficult to stay on your messages. And people want that. They want to know who you are. They want to know what you believe in, what you care about, what you're passionate about. But just to take a step back, over the last 5 years, we found that mistrust and misinformation are pervasive, right? It's pervasive. In fact, it's hardened and crystallized, and it's not going away anytime soon. And so, this idea of rebuilding trust, for starters, it's going to take some time. It will not happen overnight. But I do think there are strategies and tactics that public health officials and leaders can take and start to rebuild that trust, right? And so when you're talking about your messaging, make sure it's clear, consistent, and transparent. People want to know, well, how'd you come to this decision? You can't just say, I know better than you. That's how I came to this decision. That's not going to cut it anymore. We tried that. It didn't go so well. And Nick touched on this, and I think he's spot on, this idea of tailored messages, right? So that could look like a lot of different things. It could be tailored within a state. It could be tailored within counties. It could be tailored down to zip codes. It takes a little bit more time, a little bit more resources, but I guarantee it'll be a lot more effective. When I talk to folks like in Oklahoma, and so we're talking about media, traditional media, Oklahoma, Texas, North Carolina, and we're talking about pitching op-eds and pitching stories, they are not interested in pitching the New York Times, right? Now, don't get me wrong, I love the New York Times. They still do a great job, and I would love to get something on the front page of the New York Times or an op-ed place. But when you talk to people, they're doing local work on the ground. They want to be in their local papers. People in Oklahoma want to be in the Oklahoman. Folks in North Carolina want to be in the Charlotte Observer. And part of the reason behind that is because that's what their local politicians read. So in particular, if you're in the public policy space, you want to be able to influence those folks that make a difference in your lives. So truly targeting to local messages for local people. Local politics is huge, as we all know, and local culture. It's important now to really think at how we're going to target these folks because, as Nick said, one size does not fit all. And so all these efforts said a bit there, but all these efforts are really going back towards the original question, which is how do you build trust? Clear, consistent messaging.
Yeah, thank you so much. And thank you all so much. And I'd love to ask you a follow-up on that, Che, because it
Mhm.
seems to me that, I mean, when you talk about consistency, like one of the big challenges during the pandemic was like we just didn't know. I mean,
Exactly.
we just didn't know. Like
Yeah,
science just didn't know. And there's always sort of a margin of uncertainty, right?
always.
And nobody like really likes uncertainty, and yet it's
Right.
kind of the only fact of life that is
Yeah.
really, unchanging. So how do you, I mean, like what would you say, and it
Hmm.
takes some inner work too, right? Like
Yeah,
because we all want to sort of know what we're talking about and like
of
be
course.
the smart one in the room, and especially people who really value education and like being
Hmm.
right and being
Hmm.
factual and everything. So like how how do public health officials or anyone
Yeah.
wanting to communicate, like how do you communicate like basically the best that we can know
Hmm.
now, while kind of taking into account that that might change, right? How, like, what
Well,
is
you know
that
what,
balance
Sarah?
like?
You know what I would say? Say that, right?
Yeah.
When I consume a lot of media, right? It's part of my role and just in life, right? Um, People really value when someone says, I don't know. They value that because they know if you say, I don't know, that you're being honest, that you're not going to lie to them, that you're not just throwing out something that you think you know, right? That honesty builds so much credibility. It really does. When you say, "Look, I know I'm an expert in this, but I don't know right now," or just saying, "You know what? It's evolving. We'll find out more." Just being honest. I think, depending on who you talk to, that was an issue during COVID, right? Things would change. Do masks work? Do they not work? Does social distancing work? Does it not work? Right? And all these things started to build up this level of mistrust. Like, well, I don't know if I should believe this person that's an expert. I don't know if I should listen to folks in the federal government. And so I think if you're an expert and if something comes up and you don't know it, say, I don't know. But you know what? I'll get back to you or I'll find out the answer. In fact, that is something that we coach in media training when someone's getting ready to talk to a reporter and a reporter asks a legitimate question and they just don't have the answer. Like, you know what? I don't have it in front of me right now, but I'll get back to you. So I think
Mm-hmm.
that honesty and that transparency will go a very long way. We're living in different times now, and it's going to be critical that folks are just upfront, honest, and again, transparent.
Yeah, thank you. And it seems to me that there's some authenticity that goes. That's another one of those words that's been bandied about a
Exactly.
lot, but like
For
I think
sure.
people want to hear from real people, right? Which probably
Oh,
explains
yeah,
some of the rise of like influencers too, which I hopefully we can talk
definitely.
about. But Sandra and Nick, I wanted to give you an opportunity too to sort of weigh in. I mean, how how do you think public health officials need to manage that balance or that edge of like what we know, what do we say, and how do we say it, and how does that relate to policy, right? Because it also seems to me like part of what got on people's nerves to some extent during COVID was like, you're telling me that I have to change my behavior based on like a local, or federal policy, rule, or restriction, but the science isn't like, right. There was sometimes a mismatch. And again, like very well intentioned and all of that, right? But like, then how do you deal with that in the context of American culture?
Yeah, so we actually had to deal with this during COVID, and we had to manage our messaging because we've been doing this messaging now for many years now. How many years has it been since the start of COVID? We started in March of basically 20. Yeah, exactly. So, our approach really was exactly what was just mentioned, is that, oftentimes we mentioned we didn't know, we didn't fully know, but then we also talked about what is the type of information we're waiting on to know better. It's not just we don't know, it's, this is the information we have. These are the decisions that are being made based on the information we have, and why. Why that, it's not just this is the decision we're making based on, what we have. It's also the why part of it. And I think that's a big thing that's been discussed here. People want to know why. And oftentimes policy decisions were made based on protecting individuals. Other times it was about protecting communities or at-risk people in the community, but not necessarily, the person, the actual person. And so I think having a better understanding of the reasons why decisions are being made is really important. I think this is also one of the reasons why our strategy was successful at the time. We've already done some evaluation of our project, and people talked about how they really liked the fact that we would say when we didn't know, why we had to do things, or what's next, or what's going on next month, or but again, we were very transparent about what studies were still needed, what information we still needed, also about why, certain behaviors were important for certain groups of people and maybe not others, because that's the other thing too, not all sort of guidelines and policies were relevant for everyone. Sometimes it was only relevant for certain segments of the community. And I think being clear about that is also very important. And so that's the strategy we use in communication. I think it really landed with a lot of people. Obviously, we had to use different strategies in the way we communicated that, because that's another story. But at least in terms of sort of the evolving nature of the science, that's really the approach that we use. And I think it worked pretty well.
That's great. Thanks. Nick, what do you think?
Yeah, and I think I'll answer from a like digital communications and strategy perspective, because everything Sandra and Chave said is actually makes a ton of sense to me and makes sense. But from my experience, what I talk to a lot of our partners about at Burness and work that I'm doing is that we can't, when we go to these online forums and we start posting information and telling people important information, if you think about it like a room with 100 people in it, if you walk in and announce this fact and then leave, it doesn't really help, right? It's like, okay, thanks. Now I have a bunch of other questions about what you just said. So that's where like community moderation, comment moderation, and response, and including investing the time and resources into that part of your digital communications, I think is really important, especially for these nuanced topics. It's important who's saying this information, which is to your point earlier, Sarah, why we're seeing the kind of growth in creators, especially among the public health conversations now, which I think is can be really helpful because people want to talk to people and real humans. But also it matters that we are getting back to people. These are two-way communication channels. It's the social part of social media. And it can be really hard in organizations to make the social part work, but it has to happen. We've got to go into the comments when people are asking questions and get back to them. There's always kind of this like shadow metric that I think we're trying to get more information on, like how many people are reading the comments. A lot of us, like a lot of us go when we see something that's interesting to the comments. And so one thing that was churning while Che and Sandra were talking is just the how necessary it is to be thoughtful about the communications or the community engagement part of your social media strategy and your digital communications, because I think it has a lasting impact on building trust and also getting back to people. And it's like the more natural way we would want to see follow up. We can't ensure, because of the algorithms and the way that social feeds work, that everyone's going to see every post you make. But once they see a post, they may go to the comments and want to learn more. And if we can be seen engaging there in real ways and answering legitimate questions, because we can get into the whole trolls issue later. But when we answer a legitimate question once, it's actually seen by hundreds, if not thousands of people. So it's a really great way for us to go into the nuance when you're asked more. But that has to be thoughtful. There has to be an approach. Who's monitoring the comments? What are we saying back? When are we saying that back? Yeah, so that was kind of the big thing that came to me there. It's just how important it is to think about digital communications larger than just broadcasting your updates, but much more community focused.
Yeah, thank you. And that was I had like a light bulb moment when you said that, because it really the paradigm really has changed from this, like, we're gonna do like a randomized trial and publish it and then broadcast it, and then everyone's gonna be like, thank you, and we're gonna be like, you're welcome. And that two-way street that you mentioned is really a different way of operating. And I want to, you mentioned trolls, and I was thinking as you were talking too, like the two-way street goes two ways too, right? I mean, like sometimes the comment section is sort of replete with um, unkind comments or like misinformation, or there's just like misinformation. I mean, we've all, I think been talking about misinformation a lot too in the last 5 years. And like deliberate misinformation, not just kind of like lack of trying or lack of finding out, if you will. So I mean, I think we'd be remiss to not touch on that. Like, what have we learned about the misinformation environment from a public health perspective, and what do public health officials need to keep top of mind in this environment to try to get the right information out there when it's so hard to cut through the noise? Um, Anyone want to jump in? Or Nick, since you're on my screen, I'm going to ask you to start.
Well, in the spirit of what we just learned, I have to say that combating online misinformation, I would not list under my biggest skills. I have thoughts and opinions, but don't take me as the trusted messenger on this. So one thing that I always do is when we're working with our partners is thinking about the ways in which people might attack what we're about to put out. We always kind of, in the public health space, it's like everyone cares about making everyone's lives better. And it's like, that's actually not true, unfortunately. And so I tend to look at things as if I wanted to take this information down. What would someone say? How could they misconstrue it? What would they do? And do we need to address that or not? We're not going to think of every single thing, and we may not change anything about what we say. But I think sometimes we don't take the extra step to say, how could this be misinterpreted? And would that actually change? Could we add one word? Could we add one source? Can we think about what we will do that would actually just avoid some of that from the get-go? And so building that into the creative process has been really important to sometimes build what I kind of colloquially call a red team, someone who has no information about this work and has never really worked on this to see this piece of content first and just tell us, and they'll say something like, this kind of makes it seem like this. Is that what you meant? And that's super helpful to be like, no, we didn't mean that at all. So that requires time and thought, but I think that's where my head goes. And it's something that I'm glad to see like more research out on. I remember, I think just yesterday, I saved a piece of research that was in Nature that I wanted to read that was kind of about individual ways that we can fight against online information. So I'm kind of on everyone else's learning journey too on this, but that's one way that we're trying to address it.
Yeah, that's great. And Sandra Tay, if you want to jump in, would love to hear your thoughts on this. In the meantime, while you're collecting your thoughts, I just want to encourage our audience that if you have questions, please do drop them in the Q&A, and we'll start working them into the conversation. So, Sandra Tay, want to jump in? Any thoughts on misinformation?
Yeah, no, I think Nick is spot on. And like, one person's information is someone else's misinformation, right? So something I know to be true or think to be true, someone else is like, oh, that's not true, right? So it's tough. It's extremely tough. I think one thing that I know that I've done working with partners, again, take an op-ed, for example, is if you make a statement about something or put a fact in there, a data, a statistic, link to it, right? So there's like, and linking to without a trusted source, right? So like journal articles, The Lancet, JAMA, like you name it, like these sort of peer-reviewed journal articles that have what you can consider credible data, credible information. You know, when I talk to my friends and I say something about a sports person or something like, oh, you got a link? Like, I don't believe what you're saying. Like, I need to trust, I need to see a source of this information. It sounds simple, but I think it's effective and it goes a long way into saying, look, I'm not just saying this. This is coming from a credible source of information that you can go click on. verify and read it for yourself. And then if you want to still have this conversation, get back to me, right? So I think a simple step is providing links and background information and context to what we're sharing online and in other spaces can go a very long way.
Yeah, thanks.
Mhm.
What do you think, Sandra?
Yeah, so we had to deal with a lot of this too over the years, lots of misinformation coming out there. Our strategy, and again, it's hard to know what was wrong or right, but this is a strategy that worked for us. We didn't actually try to address every point of misinformation out there. It was impossible. And I actually don't think it's a good strategy because it just, you'll be exhausted by the time you're done. And I think it's really impossible because there's too much out there. But one strategy we did try to do is, we thought about why people sometimes gravitate towards, bits of misinformation. And more often than not, it's related to real fears and anxiety, And so in the case of the COVID vaccine, as an example, it seemed like, and not even it seemed like it was actually developed, it seemed like it was developed very quickly, much quicker than other vaccines in history. And so people had a lot of fears about how it came about so quickly, how the funding came about, the safety profile and that and so forth. And, that's a legitimate fear. I think, we do a disservice by dismissing some of these fears and anxiety. And I think when some scientists were actually more dismissive and just saying, you should take this vaccine and kind of dismissing those fears, people started looking for, those bits of sort of information or misinformation that actually supported those fears and spoke to the fears. And so a strategy that we use, just using the example of the vaccine, is we talked at length in terms of how it was developed and where the shortcuts came about, because it was indeed developed very quickly compared to to other vaccines in history. And so we talked about where the shortcuts came. We talked about how, the sort of the bulk of the research often happens during, the mouse models and the laboratory research, and that research had already been ongoing for years that most of the public had never known about. We also talked about a lot of the regulatory aspects that sort of tend to drag the process a little bit longer. And there were shortcuts in the regulatory process and in the bureaucratic paperwork that was cut because of the emergency. And that helped facilitate, sort of the movement of getting the vaccine out there faster. And so I think because we were, sort of very forthcoming about that fear, about the fact that it seemed like it was developed so quickly, we talked about the details of why, what went behind, sort of the shortcuts and some of those details. It seemed to allay a lot of the fears. So again, this is just an example of what we did of, we kind of try to touch on what are those fears and anxieties that gravitated people towards misinformation and try to address those fears directly rather than trying to undo the actual bit of misinformation itself.
I love that. Thank you so much for sharing that. I mean, because it's, that speaks to like why do people make decisions in the first place? Right. And like we know from neuroscience research and psychology research, it's not like people aren't like, oh, here's a fact. Now I'm going to go change my behavior because of that fact. Right. Like most of the time, we sort of layer facts and rationale on top of our emotions or our values or sort of our culture or whatever. So it's just right. And so, being empathetic to how people are really feeling. It's like when you're, it's how being empathetic and sort of demonstrating that leadership that you can understand that and saying like, I'm going to try to meet you where you are as opposed to, where like I think you should be based on some arbitrary standard. That sounds like it was a really effective technique for you all during the
Yeah.
pandemic.
And even, obviously we faced a lot of people who were dismissive of the pandemic being a big deal, and why public health made a big deal out of it. But, when we talked to people who had that perspective, it really was just that they didn't like this disruption in life. Who did? Nobody liked that. And they wanted to go back to normal. They wanted to go back to enjoying life the way they knew it. And so again, it felt dismissive and like they didn't care and so forth. But when you think about it deep down, it's just that they wanted to go back to their old life, and this new life of disruption was very unsettling for everybody. But different groups of people expressed it in different ways. And so, obviously there were ill-intended, actors that were with ill intention, that were circulating then too. But I think for the most part, I actually believe that most people are pretty rational, and really it's that fear and anxiety that really takes over, and that, sort of kills the ability to think rationally. And so again, what we were really trying to do is just to address those fears and talk about how, yeah, this sucks. The fact that we have this disrupted life is awful. And just starting with that point and then kind of talking about how we are trying to get ourselves out of this.
And
Yeah.
I'll just add to that that on the digital side, the content that isn't afraid to say that is what does well. Like one of the reasons misinformation does spread so rapidly is because it can be so concrete. And so while we just talked about making sure that we say when we don't know, it doesn't mean you lead with we don't know. You might lead with we all want to get back to normal. Here's how we're going to do that, right? So using some of what we're seeing of what makes misinformation travel so quickly across the internet, which is that it's really concrete. It's really something you can grab onto if you want to, and it helps to like you want to reshare it if you believe it, kind of thing. We need to make sure that our creative content and our digital content is doing that as well. Not that it's misinforming anyone, but that when we can say concretely, we have the same goal as you, we say it, right? And we might say it up front. It's not buried. I think that we have to get to the place. What can we say concretely or succinctly that's gonna resonate with people and get them to share this out there? And those shared goals that you mentioned, Sandra, I think are one that we try to infuse into the everyday content that might be about the latest research or might be about the latest report that came out. But let's not forget like the big thing that's tying us together. That's going to get people to share it out and get it there.
Mm-hmm. Yeah, that's great. I mean, you said succinctly, I think somewhere in there, and I think it's like this is maybe more of a comment or an observation that I've observed over the last 20 some years, 25 years or so, kind of in the field. But I mean, the amount of time that it sometimes takes us in public health to like explain something or get a point across versus like I still remember commercials from when I was, growing up and a kid, right? And like there's a reason for that because those were there's a reason why commercials can get things across in a pithy, like succinct, memorable way that changes behavior. Have we learned that? Or are we still learning that? Like, should public health be looking to more, I don't know, commercial marketing, advertising
Yes.
techniques, if you will? Like, how do we think about that? Jay, you said
No,
yes.
yeah, it's funny. I told one of my colleagues here at Burnett this story. This is kind of like an anecdote, but I went to see a friend at a bar, right? And I'm talking to this gentleman next to me, and it turns out that he's a Republican from Missouri, and I'm from Missouri. So we started talking about the Kansas City Chiefs. I'm a Chiefs fan. I know there's haters of Chiefs. That's okay. That's fine. I'm used to it now. But it was a very interesting conversation to the point where I asked him, I said, "Can I take notes?" Right. So I started taking notes for our conversation, and I'm like, what do you care about? Right. And he's like, look, it comes down to the individual. And he's like, I have diabetes. I have type 2 diabetes. If someone is coming to my office to lobby me, you need to know that. Right. And he's like, there's a side that's about like my family. There's another side that's about community. They're not always the same people. Sometimes they are, sometimes they're not. So it comes down to these individual conversations. And I say, well, what if I was going to bring you like a one pager? He said, keep it simple, right? And I have to assume that there's other folks in his camp that believe the same thing. And so, Sarah, you talking about this reminded me of this conversation I had a few weeks ago. Like, it's critical that we keep these things simple. Some of these things are nuanced and extremely complicated, but where we can, save words, right, make it concise and easy to understand, I think we have to do that going forward.
Yeah, thank you. And I'll just say lucky for you, the one area where I'm totally neutral is sports.
Okay, I'll take that.
So like anyway, but no, I love that. And like let me follow up on that, right? Because I think the other thing is we hear a lot about storytelling. We hear a lot about like the stories, the narrative, and like we know that the way our brains are wired as people is like nobody sat around the campfire like reading one pagers, right?
Right.
Like people tell stories. They're
Yeah.
like, don't eat that like berry. You know,
Mhm.
John ate it and he got really sick. And that's how we communicate and sort of share
Yeah.
information about safety and risk and all the things as humans, right? So like, how does public health also, again, like, take that to heart as well when we're
Yeah.
thinking about communicating to one another and to a general audience?
Yeah, stories are everything, right? To your point, Sarah, like we can go back and find paintings on a wall like 25,000 years ago from someone drawing a bison or something, right? Like,
Mm-hmm.
and sitting around a campfire talking about an antelope they took down and fed their family with, right? So, like,
Yeah.
we are built on stories. And I recently read a piece that was being developed for fundraisers and funders. And there's a little blurb about like a bus driver who was helped by this program. And that was it, right? I'm like, I want to know more about this bus driver, right? Like, how did it help him? What was his life like? What was his background like? What were his challenges in life? People like that stuff. It's the same reason why we like good books. It's the same reason why we like good movies, because they're stories of people, right? And if you want to break it down even further, there's a formula to this, right? There's like a challenge, then there's something that came in to help their life, and then there's the outcome.
Mm-hmm.
So I
Mm-hmm.
think public health across the country, we start telling more of these stories. It resonates more. It's not just words on paper. These are people's lives we're talking about, and the impact that everyone on this webinar potentially having on the folks in their communities. So we have to tell these stories. I think it's critical.
Yeah, I think that's great. And I love that I know that that challenge, choice, outcome sort of framework from I'm sure it's widespread, but
Right.
you know, there's also from some pretty phenomenal work by Marshall
Mhm.
Gans at the Kennedy
Mhm.
School around like public narrative and sort of how to
Yeah.
tell your story as a leader and then tell the story of us and then the story of now and like why that's so important. So maybe that's something
Yeah.
else we can share out in the resources later. But like um, and that takes some deep work too to sort of like figure that
Mhm.
out, right?
Oh
So
yeah.
I want to so I just want to point out, so we have 19 minutes left in this webinar. We still don't have any questions from the audience, so please folks don't be shy. I know it's probably lunchtime or breakfast time where you are. But if you're curious, please go ahead and put a question. Even if you're like, I'm totally overwhelmed, like I don't know where to start, like put that in the Q&A. I think you can put it in anonymously. Um, but let me sort of ask you guys this. I mean, thinking about some of the threads, like very, very practically, from if you're a public health official or, you know, maybe, um, you know, you're someone who works in public health, and we're coming at this conversation with this idea that like everyone in public health is now on some level expected to be a communicator, right? And you know, we're talking about storytelling and like new digital strategies and Instagram video. We haven't talked about Instagram videos, but anyway, but that's part of it, right? Influencers, like how how and we know that the public health workforce is already contextually like very strapped, very stretched, very thin, like probably feeling a little wounded after kind of what happened during the pandemic, right? That like all that hard work was not necessarily appreciated, and in some cases it was attacked, and all those other things, right? So like, how do public health officials take some of those like limited resources in terms of time, energy, attention, and all the motivation even, and like apply them to some of these principles? Sandra, we haven't heard from you in a little while. Let me ask you to start if you have some thoughts.
Sorry about that. Yeah, I mean, public health officials are definitely strapped, obviously during the pandemic, but not just the pandemic now too, because of all the funding cuts that are, seem to be coming at us. And it's just getting harder and harder, and especially for our colleagues at CDC. So I think first acknowledging that this is just an extremely challenging time for everyone. But it's also why I really was trying to emphasize too with our efforts at Dear Pandemic that it doesn't have to be anything big, right? It could just be talking just to your family and just to your friends, telling them, talking to them about what's going on. One thing that I did learn even through this experience with your pandemic and those nerdy girls is that a lot of our own family members didn't even know we were in public health. And again, because I come from a family that's sort of a first generation college grad, that sort of thing, people don't really talk about their work so much because it's more about paying the bills and that sort of thing too. So I never really talked too much about what I did for a living. And so In talking to more and more public health officials and professionals, we've also learned too that a lot of their own families don't really know that they're in the field of public health. And so I think, just getting more open and transparent just with our loved ones. I'm not talking about going to the public and getting trolled and dealing with sort of that hostile environment, but just kind of dealing with people in your own personal communities. And letting them know that you're in public health and talk about what you know and just translating the science on an interpersonal level for these folks, I think is a good place to start. And for many people who are just tired at this point in terms of public health officials, that might be enough. And I think that's all we're really asking people to do, just in a small, because there's I mean, you think about the sheer size of the public health workforce. If we're just really talking about, two people in our inner circle, we are reaching a lot of people. And again, these are people who are loved ones who maybe are less likely to be trolling you, who may be more engaged to have a dialogue with you. And then from then on, again, one of our, sort of points of success with your pandemic is that those people that we talk to in our inner circle, they're the ones that shared the information that we shared with them. So it wasn't really just us doing the communicating. It's, we help teach the people in our inner circle, and then they continue to sort of relay that information to other people as well. So I think just, I think first acknowledging that it's just such a rough time, but then also just starting small if that's all you're capable of right now, and having that just be okay. For those that do have more bandwidth, who are angrier and want to do a lot more, obviously we've talked about different efforts to become more involved in and sort of amplifying your voice in terms of science communication. And there's definitely space for you here too.
That's awesome. Thank you so much. And I'm so proud of y'all in the audience. You're putting some questions in the chat, so that's great. And so I love what you said, Sandra, about starting with your family. I mean, kind of coming from a family where it's like, you do sort of get that question sometimes in public health, like, what do you do? Like, you're not a doctor, you're not a lawyer, like, you're not like a fill in the blank. It's like, what are, and I just want to say, personally, right, like having kind of struggled with that, because there isn't always like a good elevator pitch for public health. It's probably something we all could work on. But I think of sort of superheroes coming in and like saving the city from, I don't know, some crazy like thing that's falling out of the sky, right? Like in some ways we're all sort of in this field that's like we're heroes of health, right? Or whatever. I mean, not to be too I think maybe sometimes we even have a feeling of like needing to be very humble about it, and maybe I think just being like proud of our work, right? Because it's really incredible life-saving work. So
Yeah, and I'll also say it's just really important. One of the things that with our group of those nerdy girls into your pandemic, a lot of people came from states and families where the politics are much more conservative. And so, I think especially public health officials, it's probably even much more hostile environment to operate in those places.
yeah.
But I think that's why just starting with, small, just with your own family and just starting there is really important. And I think that was, again, a piece, sort of a part of our success too, because just, a lot of my colleagues came from these places and these types of families and just started those conversations just with their own family members. They were tough, but again, these were still otherwise good relationships, trusting relationships, and that's where they started. And then the information, went out from there.
Yeah, I love that. And I want to try to get some of the audience questions. Someone asked, like, if you're in public health and you're engaging with a hostile audience, how do you get their guard down enough to have them hear your stories and messaging? And I think, you're talking about like starting small, starting with the people starting with those trusted conversations. Are there, Che or Nick, like what are your thoughts on how do you even and one question, like, do you even start with a hostile audience, or like, how do you,
Right.
is there a middle ground? Like, how do you start to think about that
Mhm.
from a communication standpoint?
Yeah, I think, and it's a really good question. It's a fair question. I think going back to sort of how we started this conversation about tailored messages, right? I would encourage, if I was advising someone, do as much homework as possible, learn about the community you're talking to, learn about this group you're talking to, what's happening there. For example, if you're talking to a town hall in Western Texas, pretty sure measles is going to come up, right? So being aware of that and knowing that sort of stuff. Where are you talking, who you're talking to, what matters to this community the most, and being prepared. I mean, preparation is priceless. Like being prepared for a conversation is priceless. And the other thing too, I want to say is be as extremely as close to home as possible. Most people I know care about their families. They care about their friends. They care about their loved ones. I think if you can bring down what you do as a public health professional to that, not even local level, like that home level, I think it'd go a long way. And I'll just say, as we're getting close on time, that all the professionals on the call, like we need you, right? We need you as a nation. We need you as communities, and your neighborhoods and your cities and towns need you. So, just know that you have our support, and we hope that keep pressing forward.
Yeah, that's great. And we had Dr. Jim Godino posted in the Q&A, like legislators tell me they do not know who we are. Who are you? We need to go engage in town halls, participate in lobby days. Are there any good examples of that in your work? I mean, I think you just brought up a good one, right? Like, if you're in that area of Texas, like go show up, like talk about
Right.
measles, show you how you can be the answer to the problem, right? And I think maybe some of that goes back to the like be in a place where you can talk about public health, right? So let me ask you this. There's a couple questions that sort of speak to this issue around like timing, preparation, and I want to kind of try to combine them just in the interest of time. I mean, any thoughts about how public health officials should respond, considering all the hoops and levels of approval we need to go through before posting? This is the questioner asks. Like, so by the time it's approved, the information is no longer relevant. And like, how do you think about crafting messages when there is potentially like that time lag? Or,
Yep.
do we need to sort of do a little bureaucracy busting? Like,
Yes,
how
that
do you,
part.
I mean, how do you find that balance between like understanding that that's probably very well intentioned around like
Of
making
course.
sure things are like accurate and sensitive information is conveyed like in the right way. I mean, this was a
Yeah.
big deal, and I mean, it has been a big deal sort of like when talking about CDC and other agencies during report. So I'll start with you and then
Sure,
love to
yeah.
hear other folks' thoughts.
So this brings me back to a prior role I had. So I've been doing healthcare communications for about 25 years, and one of my roles at a Nova Health System in Northern Virginia was crisis communications, right? And so we had a crisis plan, right? And so when something happens, grab your crisis booklet. I don't even know if they still have those. Maybe it's an app these days, but grab your booklet and you know what you have to do, right? So that's just an example of like already talking about this stuff, already having a plan. So we work with partners, and Nick's involved in these conversations. Like if something breaking news happens, do we respond to it? Do we not respond to it? These conversations need to be had up front ahead of time so you know the process, right? And in fact, you know what type of stuff you'll respond to. We'll talk about A, B, and C, but we're not going to talk about X, Y, and Z because that's not our area. And so having these conversations ahead of time should reduce the response time, be more efficient in terms of getting things approved, right? And then be more effective when you deliver it because everyone's on the same page because you already had these conversations. So I think that pre-planning, having those discussions internally before something surfaces externally will go a long way.
Yeah, that's such a great point. And I think it's also interesting to me that in the media environment, right, going from like a more traditional sort of top down, like where you're not going to get like every tweet approved or whatever we call them,
Right.
whatever Instagram reel approved, to like so many more people kind of just going out on their own and like posting their own content. And it's like, I wonder if part of that trend is people are just like, I'm not waiting, I'm not waiting for 12 and teen layers of approval before I get to say what I want to say. So I don't know.
I think that's right. I think organizations could lean into their leaders posting online more often as themselves to help pare down the amount of reviews that need to happen. There's still some conversation that has to happen about what they're saying on behalf of the organization, but there's a lot more leeway when a human is putting it out there than when a brand or organization is putting it out there. And so it gives you some space. And getting thoughtful about that, I think, can be helpful. I also think having the conversation, mapping out your current process and showing to the people who are making decisions, it takes us 12 days to get there, and using some of the research and the conversations that are coming out about that we're losing the battle on misinformation, that we're losing this, can help you streamline it and say, who has to see this? what can we right now? Where can we go? Like having the conversation and pointing it out, I think is super important. And people are looking for solutions right now, and pointing out one solution is to streamline could probably be well received in this moment. So if you've had that conversation before and you're defeated by it, it might be time to try to have it again. I think you may see a different response. So.
Yeah, and at the risk of like trying something I haven't tried before, like put a +1 in the chat if you're in the audience and like you have a rapid response plan in your organization. And this may or may not work. So like this isn't scientific, but I'm kind of curious. So in the few minutes that we have left, we just had one other Q&A from the audience, and then I think we'll wrap. So somebody asked kind of like, how do you handle individuals who do have credentials and kind of have those maybe loudest voices, like putting out dangerous misinformation, right? So like not just like a rando on the internet, but like someone who maybe has a PhD after their name or whatever. Thoughts on that?
So I think an effective thing I've seen online for this is going directly back to them on the platform where they're doing it and having the conversation. You have to be prepared for that, but I think I've seen this done well, and also not antagonistically saying, "Hey, I'm not really sure why you said it this way, but I'm really concerned about what could be taken from it. So I just wanted to clear up that this is here." Oftentimes I talk to partners about considering doing this via direct messages first, because sometimes the intent was not there and you start an online conversation that gets worse and antagonistic. So starting with a direct message, if you don't know the person and it doesn't get responded to and you think it really needs to be, addressed, using it as a prompt to then bridge to the positive conversation and things you want to talk about, I think can make an effective strategy. But also maybe don't get distracted. Maybe make it let you think of content you need to make. Like we don't always have to go. I think Sandra, you said this. We don't have to go and fight every single battle. And so, sometimes it'll make sense, and sometimes it'll be like, noted, I need to make some content that gets to this nuance and explains this without even starting from the antagonistic, we're going to go back and forth. So just use it as an idea generator for what you could be talking about, and do it on your own terms in a way that you know is factual. I think that's a really helpful thing. It can be really helpful to see what's out there and then say, what could I be talking about to add to this discussion in a positive, helpful, accurate way?
Yeah, and that's exactly what we did, by the way. There was a lot of people with MDs, PhDs putting out bad science or misinterpreting, and instead of, sort of taking that head on, oftentimes, these folks would, cite a particular, research project, but often the results were misrepresented or something like that. And that, and so what we would do is we'd go back to that original research and talk about, ways it was misrepresented, what were the correct interpretations of those findings. And that's kind of one of the ways, that we went about unpacking, what was behind some of those misstatements made by other people.
That's so interesting. Thank you. So, okay, in the 3 minutes left, I will just report out that my put a +1 in the chat was a miserable failure because y'all in the audience can't access the chat. So I apologize for freelancing there, but maybe coming up with a rapid response plan could be a future webinar topic if people are interested enough. And obviously we've talked about so much here that we could follow up on. So maybe just in the minute or two we have left, I'd love to ask, and Sandra, maybe we could start with you, like just a couple key takeaways from today's conversation, like anything that's really jumping out at you as to what you hope the audience today walks away with. And I'll start with you.
Yeah, I mean, I think I'll end with what I started with, is that, I think everyone should get involved in science communication. And again, starting small is good enough. It doesn't need to get any bigger than that. Just starting with, your loved ones, and also because it helps you practice, health communication and refining your messaging. So I think just starting there, you can get bigger from there, but you can also just stay there. It doesn't need to get bigger than that.
Thank you. That's great. Nick.
Yeah, I would say a big takeaway that I want people to take with them is keep it personal. like why you're in this, what your passion is, and what your work is can be interesting to other people. Sarah, I think you said sometimes you think people in public health are too humble. I totally agree. Like you're doing really interesting work. It has meaning in the world, and if we can tell those stories and put that into our content, I think that would go a long way in getting the important research in front of more people. So make it personal and don't be too humble when you're putting it out there, I think is a big takeaway.
Yeah. Yeah. Maybe we need to call, like, call ourselves like the measle busters or whatever, like
Yeah.
something,
Well, and also
something
just
catchy.
like, yes, and just make sure that why you're doing it is infused into the content, not
Yes.
just here's this thing. Here's this thing is not as engaging as here's this thing I worked on for 5 years and I care a ton about and I think is going to make the world a better place. That's such a more interesting thing to
Uh,
hear. So.
that's starting with your why and not your how. So important. Che, your thoughts?
Yeah, I would just say, first of all, great conversation. Great job hosting us, Sarah. I would just say, if you're coming up with a communications plan, start with your goal. What are you trying to achieve? You have to start there, then your audience, then your message, and then the best way to reach that audience and communicate that message. So,
That's awesome.
yeah.
Well, thank you all so much. This has been such a fantastic discussion. I've learned so much. Thank you so much to the Association of Schools and Programs of Public Health for hosting us today. You can see here on the screen some resources, which I think we've also been posting in the chat as we go. And I'm sure this will all be on the website as well as a recording at some later time. So, yes, there it will be on the webinar event page. If you have further questions, thoughts, comments, wish lists for future webinars, get in touch with external relations at aspph.org. Thank you all so much for joining. It has been an absolute delight. And don't forget to put March 11th on your calendar from 12 to 1, leveraging your public health degree in unique ways. Oh, I can think of some people who will be very, very intrigued by that. So March 11th at noon. We'll see you guys there. Thank you again.